Hi everyone, welcome to the Crisis in India live stream by Kira. We'll be starting in like a few seconds now, so we'll just wait for um, that time, I guess. I'll just start off by introducing myself. My name is Divya. I'm one of the co-founders of Kira.
I'm Ria Kupa. I'm another co-founder of Kira Project.
I'm a graphic designer at Kira Project.
And I'm Nithya, and I'm one of the secretaries for Kira Project.
Hi everyone, welcome to the Crisis in India live stream by...
So sorry for the technical difficulties right now.
Ria, do you want to start off?
Okay, so we're just gonna start off for this thing. So what we're gonna do before we go into the actual live stream is we're gonna give you a bit of an education seminar. So there's 4 parts to this. We're gonna start with the introduction. In the introduction, we're gonna tell you about like why we're raising awareness for India and these causes. Then we're gonna talk about what happened in India and starting from last March, how we came to this point. Next, we'll give some statistics and give you a bit more details about what's happening down there. And then finally, we're going to give you a course of action. So what can Cura do to help and what can India do to better itself? We'll start in a couple minutes.
Yes, and throughout the Educate seminar, if you have any questions, feel free to just post it in the YouTube chat box, and we'll answer them as soon as possible. So we'll start at 3:05.
In the meanwhile, do you guys want to get started with having them register for the auction?
Yeah, so next slide. So we're going to have later towards the end of our live stream, we're going to have a live silent auction. If you want to get started on that now, go to the link at the bottom of our screen and someone will send the link in the YouTube chat right now. Additionally, if you'd like to donate, we're going to give money. All of our money goes to Give India. Go ahead and use those QR codes if you want to donate to PayPal or Venmo. And we'll walk you through how the auction is going to work a bit later. It's really exciting. We have 2 items up for sale. One is a painting that's fall inspired, made by an artist named Sabrina Fang. And then the other one is a Cura bundle. So you'll get a couple of our Cura hoodies and a couple stickers. And again, we'll start at 3:05.
I just put the link to the auction in the YouTube chat, so you guys should be able to register for that auction now. And we would really appreciate if you took part in that auction or just at least donated for this cause that we're doing for this week.
Okay, we'll go ahead and start the education part of this live stream. So India is experiencing one of the worst outbreaks of COVID-19 in the world. New cases are surging with a whopping number of 400,000 cases per day. Hospitals have run out of basic medical supplies, with many patients dying due to oxygen shortages. Family members are driving from clinic to clinic, frantically searching for open ICU beds for their loved ones.
And to kind of lay out what happened already in India, in early March, the infection rate of India started seeing a slow upward trend. By the end of the month, the cases had multiplied by 6 times. The huge exponential rise has continued all the way into May, and it's at its all-time high. Second wave hit so much harder because people were so much more unprepared for it. Since the first week peaked in September, and daily cases declined steadily in the following months after that peak. The apparent recovery seems so successful that the country's health minister declared in early March that they were in the end game of the pandemic. And the country's vaccination drive, among the largest and most ambitious, got underway in January. Residents relaxed COVID-safe practices like social distancing, and authorities were looser in their enforcement. So they had very laid-back protocols with COVID, and that's kind of what led to the second wave. Although some states stayed cautious and made preparations for a second wave, none of it was enough, and nobody foresaw the massive coming wave.
Now we're going to look into some statistics with India and its COVID-19 crisis. So there's about 400,000 new cases per day that are reported in India, breaking the record for the highest single day figure globally. Scientists warn that the country will continue to see high mortality through the month since deaths lag behind the rise in infections. Only about 34% of deaths are happening in hospitals and facilities, meaning many fatalities that occur at home or elsewhere may be missed in the official count. As of May 11th, at least 24 of India's 36 states and union territories are under some form of COVID restrictions. As of May 11th, India has administered more than 168 million doses of vaccines, according to data from Johns Hopkins University. More than 34 million people are fully vaccinated, which is about 2.52% of the country's total population. The United Kingdom has sent more than 1,700 pieces of medical equipment to India, including oxygen concentrators and ventilators. There's about 26.9 million cases of COVID-19 reported in India currently. This number is likely much greater because India's case detection rate is about 3.4%. And there's about 307,231 reported deaths in India due to COVID-19. On last Friday, a report by the World Health Organization estimated that the global death toll of COVID-19 may be 2 or 3 times higher than reported.
So what is the course of action for this issue? The Indian government is preparing a stimulus package, although there is no update on how it is going to fund. They're also using an outdated plan, especially the medical protocol, which is far outdated compared to more developed countries, which is also part of the problem. People also haven't been social distancing or taking the pandemic as seriously as in other countries. There are a lot of religious ties to this as well, including the belief that a higher power will take care of the crisis, rather than investing in social distancing procedures and healthcare privileges for all. The government has begun to roll out vaccines, however, they haven't campaigned for them, and the recommended treatment for COVID isn't even proven to work. Smaller organizations are working towards providing accurate resources and information, as well as spreading awareness to the severity of the situation, much like us.
Okay, that was the education part of this organization, and it was pretty educational, if I say so myself. It's super important to actually know why we're doing this this live stream for. There's a reason that we're hosting this whole week worth of India relief projects. So it's really important that we went over all this stuff. So next, we want to go on a little bit of a break. But in the meantime, we're going to go into our call-ins. So if you'd like to join our call-ins and just talk to us, give a bit of testimonial about what's happening in India, please join that tiny URL that's on the screen right now. And additionally, another reminder is if you'd like to donate, use the QR codes for PayPal and Venmo. And we would love to get some money in there for us. Thank you.
Yes, and during this time, if you have any questions about the Educate seminar or about the upcoming call-ins, feel free to be posting that in the YouTube chat, and we'll be checking on that. We'll answer them to our best of our abilities.
Okay, I think we should move on now. Keep going. And again, just a reminder, if you'd like to join our call-ins, please use that link, that tiny URL. We'll also put it in the chat right now. I think Divya will do that. Okay, move on.
So up next, we have a call-in from Karina, and Let's just take a look at it. So this is our first call-in for today.
Hi, everyone.
Hey, Nithya, can you restart the video and unmute?
Um, Hi, everyone. I'm Karina Cagerwell, and I'm one of the co-founders of Cura Project. I'm really excited to have volunteered myself to talk about what's going on in India and kind of my own experience through this whole thing. I know that the news has not put out the most orchestrated story out there. It's very sugar-coated because, frankly, no one actually knows what's happening. The death counts, the COVID rates, it's not accurate, and no one actually knows the real numbers, though we do know they're higher than what's being reported. And so it's really important to understand the condition and what is actually happening, and then how you can be of help. So I think the first thing is to recognize that this similar thing happened to the United States last summer around, but in a much different scale. Here we have the infrastructure, we have the vaccines. Here we also have the hospitals, the healthcare system to sustain this. And we have 1/3 of the population. In India, we have triple the population. The economy is much more weaker. The healthcare system is a lot more broken, and vaccines aren't able to get out as fast. With a combination of all of this, what this entire live stream is about is then presented. And it's really important to understand how, with all this going on, how can you help? I think watching the news right now is really scary, and it can be a trigger for a lot of people. And it can be a little heartbreaking. I think with me personally having family in India, you hear people being a little worried about like, hey, I don't know if I can talk to you again. And I think that's really scary because now at this point, everyone's like, I'm gonna get COVID, it's a matter of when. And the reason the matter of when is really important is because I can get it today or I can get it 2 months from now. Now, if I get it today, the condition is terrible. Hospitals don't have oxygen, they don't have beds for everyone. Even if I don't have COVID and I'm sick, it is a struggle to find a bed in a hospital. And if I do find a bed, my family isn't allowed, so you're alone. 2 months later, we're hoping the curve goes down. And if the curve goes down, then that's when you have more access to oxygen, maybe better doctors, and a room in that area. And so that's the condition that's happening. It's a matter of when am I going to get that? And so for my family back in India, everyone lives in big cities, and big cities means a lot more population, and it's scary. I think one thing you have to think about is no one is able to talk about it because talking about it makes you scared. And so expressing those feelings is very scary. But I do know that like every day it's like a scare of like, is it going to happen today? Is it going to happen today? Is it going to happen today? And I think it's safe to say and unfortunate to say that every family has a close death, a close family member who died either due to COVID or from another condition, wasn't able to get a hospital room because COVID has taken up hospitals. And so that's really scary. Even if you don't have COVID, you're still very unreliably getting healthcare. I know for myself, my grandpa's going through the exact same thing where he's not able to find a hospital room, and somehow, very thankfully, we were able to find one for him. But that's not the case for almost majority of the people. If you're sick, you're not going to find a healthcare room, and you're going to have to try very, very difficult. And so anything helps right now, whether you donate, whether you learn more, or you just contribute yourself and take some time to educate yourself on how privileged we are here in the US, what's happening in India, and then maybe donating if you can. But thank you for listening, and I'm really happy that everyone was able to join this live stream. Bye.
Wow, those are some great words and very inspirational and motivational. Thank you so much, Karina, for attending this call-in and giving us an insight into what you and your family have been experiencing during this pandemic.
Again, just one more reminder, if you would like to join and do something similar to what Karina just did, join that waiting room. That tiny URL I just sent in the chat. We could talk with you a bit, and then we can add you into this call. It'd be really fun. So really recommend doing that. Go ahead and join, and then we'll see you later. So we're going to take another just 5-minute break, and we'll move on.
Just a quick reminder, the break will be ending at 3:22.
Okay, we're getting started again. Okay, perfect. So we'll get started, and now we're going to move on to our video interviews. So we have a couple people lined up, pretty exciting people. First up, we have Dr. Deepthi Rosario. So
Yeah, and this, just to preface this interview, she is a doctor that is currently living in Goa, so she knows this situation kind of firsthand. And Ria did this interview with her, so it should be pretty exciting. And then after this interview, we will go into the cooking show, and then we'll do our live video interviews.
perfect. Okay, let's go ahead and start.
Hello, can you please introduce yourself and your connection to India?
Hi, I'm Dr. Deepthi Rosario. I'm an Indian. I'm born and brought up in the tiniest state of India, that's Goa, and I've lived here my entire life.
Oh, perfect. I know a lot of people from Goa, though, too. It's a beautiful state. Yeah, so can you explain in your own words the crisis in India?
So the second wave of COVID has really just brought India down to its knees. It's nothing like what the first wave was. And I guess there are no beds in hospitals, there's no oxygen. Doctors are completely overworked, overstressed. The doctor-patient ratio right now is crazy. We're losing a lot of people. We're losing a lot of younger people this time, people in their 20s even, people in their 30s. So it's been a really, really difficult time for us. And I just want to bring attention to our state of Goa. So, we're famous for our beaches and we're quite a tourist destination. And with travel being difficult this year, a lot of the rest of India has kind of flocked to Goa in the intermediary time between the first wave and the second wave. So tourism was kind of going on really unchecked, and people weren't wearing their masks. There wasn't enough social distancing. The rules that should have been enforced really weren't. Tourism was just completely Goa as a kind of escape from it all, and we started paying the price slowly. And by the time the government really came in and put in restrictions and enforced a lockdown, it was too late because we were so far gone. The medical system was just completely overwhelmed. So that's something that's been really unfortunate.
Okay. How have you been personally affected by the COVID crisis, and how has it affected your family and friends?
So I was just talking to my friends about this recently, and they had this really interesting point to make because they aren't doctors. And they said how hearing about a death is not something that, shocks them anymore. Because everybody we know, we're such a small community that, everyone has lost somebody that they love or somebody that they knew really well at this point, because there have been so many deaths that have happened in our state. And I think that's really sad that it's just become, I personally have, I haven't lost anyone who's family, but I have lost like somebody who was quite close to me, who was a mentor, and he was fit, he was healthy, he had no other medical issues, but he couldn't get to a ventilator in time. They actually had him in an ambulance, just going from hospital to hospital trying to get a ventilator bed. And for somebody to die because they don't have access to oxygen in this day and age, and that's a pretty sad and unbelievable state of affairs that we're at. And personally, family wise, I had like a lot of family members who got COVID, and everybody got it at the same time. And just the stress of thinking, are they going to make it, are they going to get really bad? Some of them needed to go to hospital and you couldn't get beds, so you're on the phone all the time begging hospitals to give you a bed. You're being put on dozens of wait lists. It's just so stressful, and there's so much uncertainty around it all. It was just like a really difficult time.
Yeah, I totally can relate. I know so many people who have lost family and friends, and they also say hearing about a death, it doesn't really surprise them anymore. So going off of that, do you have any advice for those listening?
So I would say we have to approach COVID on a war footing now, because it is a war and we're losing. If we hadn't gotten so complacent after the second wave, after the first wave, because we did know that a second wave was coming, and we didn't amp up our infrastructure, and we just weren't prepared. We didn't have enough doctors, we didn't have enough beds, we didn't have enough oxygen, we didn't have the infrastructure to deal with it when we knew it was coming. We didn't, do simple things like maintain social distance and wear masks. We didn't go get vaccinated. There's still so much taboo around the vaccine. Just go get vaccinated. It's just like the silver bullet that we have. It's the one, solid thing that we have with us right now, the one weapon that we can rely on. So even now, people are apprehensive about getting the vaccine. So just go get it.
Agreed. How do you think Cura can use this platform to help those suffering in India?
So I think we can bring awareness. You guys can help bring more awareness to the situation, and also tell, people don't, it's surprising, but until it happens to you and it happens to somebody that you love, people are still not, really grasping the seriousness of the issue. So if you can just bring that awareness that we need to hold our governments accountable. We need to do what little we can to keep the pandemic at bay. Even if you're vaccinated, just, bring awareness that people still need to wear their masks, they still need to maintain social distances, they still need to wash their hands. If you could bring out more awareness about vaccines and how, how it's safe, because people are still so scared. A lot of people in India, especially rural India, there's so many rumors and myths and taboo around the vaccine, and people are still refusing to get vaccinated. Also, there's a lot of mental health impact on people in India because of the pandemic. People have lost their jobs, people have lost their family. Staying in a lot of the time, people are more at risk of domestic abuse, and kids are just losing their minds because a lot of them are really small and they don't know what's happening, why they're cut off from everything. Other older children and young adults who they were just at the brink of starting a career or choosing a path in their lives, and everything's just thrown up in the air. So there are a lot of mental health issues that I think are not being addressed enough right now.
Okay. Have you done anything to help your community? If so, what have you done?
So my husband and I are doctors. So we run a maternity hospital in Goa. So we've been dealing with pregnant patients who have been having COVID. So we've tried to kind of be of support to people that have COVID and are kind of trying to manage the disease at home. Being on the phone with them, telling them what to do, what meds to take, when they need to go to a hospital, and trying to kind of be their support through that time. And especially being pregnant and getting COVID is something really, really scary. So trying to bring awareness around that issue, and breastfeeding moms, trying to get them to take the vaccine and protecting their babies, what to do, things like that.
No, I could only imagine the struggle there. And finally, to wrap it all up, what can we do to support each other?
I think we need to just, I think a good thing that's come out of, if you want to look for a silver lining, is that in the second wave compared to the first wave, a lot of the stigma has gone and people are a lot more supportive, and people have just come out in support of each other, and that is amazing. People have already extended physical, emotional, mental health support to each other, and it doesn't have to be family, it doesn't have to be somebody that you know, but I think to just be there for people. There are so many online platforms right now in Goa where people are delivering free food, people are offering, that you can just be there as a listening ear if somebody is alone and is with COVID, older people who have no access to medical care. There are so many online platforms and people are doing so much. It's fantastic how the community has just rallied. It's just amazing.
100% agree. Okay, so that wraps it up. Thank you so much for joining us today.
Thank you for having me. It was great meeting you.
One last time.
Great. A big thanks to Dr. Deepthi Pinto Rosario. Right now, we're going to move on to our cooking show. So this one's super exciting. We got someone who was able to record a cooking show for us, and we're making some great food there. So if we could go back just one slide. Forward slide, yeah.
Yep, so here's our cooking show. And today, Miss Sonali Gupta is going to be cooking kadai paneer for us, and we're going to be taking a look at the recipe.
Hello everyone, my name is Sonali and today I'm going to show you how to make kadai paneer. Before we jump on recipe, I will want you to introduce with paneer. Paneer is Indian cottage cheese, very common in India and made up of cow and buffalo milk. So process of making paneer is curdling of milk with some fruit-based acids. So now you can easily find paneer in almost every Indian store in your local area. Even some mega store in US have also started selling this up. There are many popular dishes of paneer, like paneer pulao, when paneer is cooked with rice, and also shahi paneer, when paneer is cooked with the creamy gravy. But today I'm going to show you kadahi paneer. So paneer is cooked in kadahi paneer with stir vegetables in semi-gravy. Let's look at the main ingredients, what we need for this dish. As I said, paneer, I bought from store. We need ginger and garlic. And for the stir-fry vegetables, I have taken some colored bell peppers, chopped onions, and tomato puree. Now let's look at the spices that we will be requiring for this kadahi paneer. So we will be needing some dry Kashmiri red chilies, fenugreek seeds, coriander seeds, Kashmiri red chili powder, coriander powder, turmeric powder, salt, and some cumin powder. So best part of this dish I like is it can be made with simply available ingredients at home. Let's start the preparation for making this dish. I'm starting with cutting up the paneer cubes. So I will try to cut the paneer pieces in equal sizes so that it will look the dish good. Like this. So in this way, you can cut all the cube pieces. And also I will cut the bell pepper again cube sizes. Now we have all the ingredients ready. So let's get it started. I'm turning off my gas. I'm adding 2 tablespoons of oil. I'm using olive oil here. Let's heat it up. I'm starting with my dry chilies, putting in the oil. And saute it for a few seconds. Next thing, I'm adding 1 teaspoon of fenugreek seed. I will crush my coriander seeds a little bit so that the whole seeds don't come in your mouth when you're eating. This is where I like to do. Some people make kadai masala with all the chilies, fenugreek seed, and coriander seeds, but I like to put as a whole. This gives a good flavor. Now I'll add my chopped onion in this. And saute it for a few minutes till the time it is light golden brown color. Now you can see it's slightly light brown in color. At this point, I'm adding inch of garlic and 2 cloves and adding into this and sauteing it for some time. So that the raw smell of onion, garlic, and ginger goes away. Now I'm adding a little bit of turmeric powder and Kashmiri red chili powder. This is very important in Indian dishes, at what point you add the spices. This gives a good color and the texture to the dish. And there is no overcooking of spices, or there is a, it's not that burnt as well. Now I'm adding my tomato puree. In parallel, while this doesn't cook well, I will start up my stir frying vegetable to get ready. I have on the gas and let the oil heat up. I have used 1 tablespoon of oil again in the separate pan. Then I'll start with stir fry my vegetables. So to give the crunchiness to the vegetables, I like to add some diced onions also. So I'm putting in here. Let it cook for 1 minute. Then add my bell pepper. You keep stirring the tomato puree so that it doesn't get burned. Or at this point, I will add some salt and coriander powder in the masala that I'm making. I have used around 1 tablespoon of coriander. I like to use a little bit coriander powder more than anything else. So spice level you can keep as per your taste. If you like little bit spicy, you can add more chili powder. But at my place, we are just medium level of spicy. Like keep stirring this one, and other side you can say onions are cooked the way I want it. Now at this point, I am just adding my cut vegetables. I mean bell peppers. So see, I had removed the seed that was on the some of the pieces, so that like and also I will add little bit of salt in the vegetables. And also I'll add cumin powder. As I said, if you like a little bit more spice, you can add some chili powder. I'll add a little bit, not much. And keep stirring this. I'll give it another 1 minute. So after 1 minute, I'm adding my paneer cubes into this one, so that it also gets some masala coat on this. Some people like to deep fry paneer, but I like to saute in this vegetable itself. See, you can see masala and the dry spices are getting coated on the paneer. I'll give it a quick stir so that everything gets blended well. And on the side, you can see my tomato gravy is that's almost done. If you like sweet and tangy flavor, you can add a little bit of sugar in this one. Now I'm turning my gas off with the stir vegetables and adding into this gravy. And we'll coat it. And you might have observed that I did not put a lot of salt because I had put the salt in the gravy. And also I had added the salt while stir-frying my vegetables. That should be enough as per our taste. But you can add more if you like more of salty. I also like to add a little bit of cream. This is completely optional. I have used colored vegetables, bell pepper, but you can use green bell pepper as well. Today I was not having it at home, so I did not, but I like to use green to give the color to the karahi paneer. I will add few cubes of tomatoes also. I did not add it earlier, so I did not want it to mushy. Let it cook for another 1 minute and your karahi paneer is ready. So you can eat this with, and this is how your karahi paneer will look like. You can eat this with roti, chapati, naan, paratha, whatever you like with, or even rice.
Wow, what a great dish. This is really looks super yummy. And thank you so much, Miss Sonali Gupta, for cooking for us today for the cultural event. Up next, we have a few video interviews. So we'll be taking a 2-minute break and we'll be regrouping again at 3:48, 3:49, and we will be doing the video interviews then. Okay, so we are going to be regrouping. And before we get to the video interviews, we're going to actually take a look at the Discord. So we have a Discord server for all of you guys to join and just give us an insight into what you were experiencing during this pandemic and just read about different perspectives, other people, and see what they are experiencing and how maybe you can help or maybe you can receive support and help. So this Discord server is just meant for you to really release your thoughts and just gain more maybe lifelong friendships or just interact with different people from around the world. So feel free to join the Discord server at this QR code up on the screen. So we'll give you guys another 2 minutes just to join the Discord server if you would like to, and we'll get started on the interviews.
I'm so sorry. Just give us one more minute. We're getting Palak, our next video interview, set up, and she should be here in a minute or two. But until then, please feel free to donate. We put in the donation links in our chat for the YouTube link, and then Discord as well. And I think Palak is here right now, so we'll start that video interview. Hi, Palak.
Hi.
All right. So do you just want to go ahead and start by introducing yourself and your connection to India?
Sure. My name is Palak, and I come from a background of India. My parents are both from India. My grandparents are both from India. My whole ancestors like runs through India, so it is whatever they're doing and what they're raising awareness for is very important and very close to my heart.
Perfect. Okay, so do you just want to go ahead and explain in like your own words what is going on in India right now with the COVID crisis, the second wave hitting, and just with that.
Yeah. So basically, in my words, the best way I would describe it is that India, as a lot of fundraisers are named, just isn't able to breathe right now, and it's going through this like phase, I guess, where they need our help, essentially with money, with resources. India is a very overpopulated country with about 1/3 of our land, but 3 times our population. And so it's very overcrowded. There's a big chunk of the population who live below the poverty line. And so in the case where a thing called like such as COVID spreads so fast and so vastly, it's a little hard to get the resources you need, especially because they're running out of oxygen, whether this be lack of government help or just like lack of space or lack of like it's a little more difficult to reach the resources, and thus many people are dying, many people are suffering, not because they can't recover, but solely because they can't reach a hospital in time, or there's no more spaces in the hospital, or they're lacking resources. So hopefully through fundraisers like this or like raising awareness, people are able to help, and like we're able to get the situation hopefully a little more under control there.
For sure, I completely agree with that. So you kind of touched on your family being from India. So how have you been personally affected by this crisis, and how has it impacted your loved ones, your relatives, and such?
So personally, I have lost a couple family members to COVID over the past year already. And it was obviously very sad. And left us with like a lot of pain and grief. But recently with this new COVID strike, my like own grandpa was infected, and he had to be hospitalized. He was on oxygen. And luckily, like touch wood, we were able to get him resources, or like my family in India was able to get him resources. But there's so many people who, and a lot of my other family members were infected, and they just weren't able to go to the hospital because A, it wasn't too severe, luckily, or B, they weren't like allowed to, because they were like, we can't treat you right now. We have patients who are literally like on the surface of like dying or living. And so unfortunately for those people, it's literally quite literally the fact of like life or death. And so seeing the situation in India quite literally broke my heart. And there's another thing that needs to be like noted and needs to be pointed out, is that what the media is showing is like only half of what is reality. It is so much worse right now. It's getting a little better, but it is just so much more worse than the media is like showing out for it to be.
Yeah, and I think there's a lot of sugarcoating that's going on, as Karina mentioned in her column before, that the media is giving to us, and I think that's just like really wrong in so many different ways. So do you have any advice or words to anyone that's listening that can relate to the situation, or even not, just in terms of COVID?
Honestly, like my advice would be to stay strong. Reach out to anybody if you need the resources. If you know people, provide as much support as you can. And literally quite like have faith. That's what got me through it. That's what is getting a lot of my friends through it. Having faith and hopefully believing that everything will be okay is your biggest motivator. Divya, you're on mute.
Oops. Okay, so last question is, how do you think that Kira can use its platform to those that are suffering in India, and what can we do to help?
So, you guys are doing an amazing job. You guys are using your platform for good, raising awareness about what's going on in India, hosting like a week of activities, podcast posts. And I think it's really beneficial because the more that people know about it, just because India's not necessarily like a third world country per se, but it is a country that isn't given enough like limelight, isn't as glorified as the United States of America is, or London is, or stuff like that. So not many people are even aware of what's going on in India. So just by like spreading the information, spreading the knowledge, getting more people aware of what is happening in the situation in itself is such a big deal. And I definitely feel like Kira's doing a really good job with that.
Thank you so much for your time, and I completely agree with everything that you said. Thank you so much for joining us, and hopefully we can see you soon in the future.
No problem at all. Thank you guys for doing this so much.
Of course.
Bye.
Bye.
Okay, so while we get our next call in ready, we're just going to take a quick 2-minute break and get them set up. Okay, I think we could go ahead and get started. Divya, do you want to get started with the video interview?
Yeah. So today we're joined by Suraj from the Indian Activist Forum. Suraj, do you just want to go ahead and introduce yourself and your connection to India?
Yeah, hi everyone. Thank you so much for having me over for this conversation. Of course, my name is Suraj, and I work with the Indian Activist Forum team. Uh, well, first off, I would just like to start off by saying that like I'm like really grateful and thankful to you guys for actually having this conversation and making sure that actually people recognize that the COVID crisis in India, it's something that does not just it's not really it's not something that's really confined within borders. It's something that the whole world should actually be looking forward to. And being a global community, we all should look out for one another. And of course, having this conversation is like we're moving a step forward to making sure that we all look after each other. And like it's just really great to be here with you guys.
Thank you so much. We really appreciate you being here and taking the time out of your day to do this with us.
Yes. All right. So talking about the Indian Activist Forum, it's still like it's still a project which I feel that it has a much larger scope when talking about its impact in the community. So this whole idea, it came into being during the CAA NRC riots that took place in India earlier this year and in the last year, where if you guys are aware about it, it's about the citizenship rights, which like there were some new laws introduced in India. And like there was a massive outrage in India, and there were a lot of people, especially the young generation, who actually took part of it. And I felt that there is a need to bring the whole activist community together under one roof and make sure that we all stand united against I'll just go ahead and say the fascist regime that's there in India. And I feel we need a government that's actually empathetic to the struggles that the common people in India are facing. And again, as I said, it's still a work in progress. We had started several on ground campaigns. We have had several fundraisers. We have even helped provide medical equipment to the police personnel. We have had fundraisers to provide like medical equipments, sanitizers, face masks, PPE kits, to government hospitals, to police personnel, to civil servants, and so on. So we're just doing whatever we can in our individual capacities. We're not funded by any organization. We're just a group of people, youngsters in our early 20s, and just making sure that whatever we like, in whatever way we can help out during this crisis, we just make sure that we do our best and make sure that our nation it just not only just survives but it strives through this pandemic, and make sure that all of Indians, they stay safe, they stay healthy, and we emerge victorious through this pandemic.
That's amazing. I think that since you kind of touched on what's happening with the COVID crisis in India, do you mind just explaining on that, expanding on that, and just like what's going on currently in India? And I assume that you live in India actually, so that's like firsthand experience for you.
All right. So I just go ahead and say that I feel that I belong to the privileged class from like living in India, because I have basic health facilities, basic living facilities available to me. I got COVID vaccinated. I got my first dose, and I'm still looking forward to get my second dose and make sure that I like me and my family, they just get vaccinated, and we're able to make sure that we do not contracept any symptoms or any issues related to the COVID-19 pandemic or the COVID-19 virus. So talking about COVID pandemic in India, frankly speaking, I thought that India would be the country where it would be leading the battle against COVID-19 pandemic. However, the circumstances, they're quite opposite of what not just me as an individual, but a lot of Indians had thought of. We have two large scale manufacturers in India of two different COVID-19 vaccines. However, we're running short on vaccines. There are state governments who are pleading to the central government. They're literally begging for vaccines. They're demanding vaccines so that they can make sure that their citizens are vaccinated. They make sure that everyone is safe from this pandemic, and whatever problems that may arise from it. So we're just making sure that we have enough number of vaccines. I mean, then there's this whole it's just a multifold problem. I mean, that it's such a broad topic. I don't even know where to really start off from. I mean, there's the whole vaccine shortage. Then there's oxygen shortage in India. There's no oxygen cylinders in India, and there's no basic infrastructural capacity in hospitals or in local level dispensaries. We have no medicines that we can avail to our citizens. So it's quite saddening to see that being a major manufacturer of such equipments, we ourselves are struggling. We ourselves are not able to provide basic health facilities to our own citizens. And it really takes a big toll on our mental health. It takes a big toll on our whole spirit of fighting this pandemic. And it's really been getting worse by every passing day. So I hope it gets better with time, but then again, I mean, again, I just hope that it gets better with time. And I mean, that's it. Like, the whole world is watching. India is not the only country that's facing the whole pandemic issue. There's a lot of country, but of course, India, like, no one had suspected that India would be the country that would face such scenario, that would face such issues. Again, being one of the largest manufacturer of vaccines, of medical equipments, of oxygen cylinders. So it just comes as a surprise to all of the citizens. But then again, we have our hopes like really high, and we hope that we are able to emerge victorious through this pandemic, and like everyone just stays safe. That's
I agree with you. Okay, so the next question is, how have you been personally affected by this crisis with just like your loved ones? How has it impacted them and you as an individual?
All right. So I have two elder sisters. I have a mom and a dad. So there's basically five people in my family. I am the youngest one in my family. I am still in my early 20s. I'm doing a job. I am pursuing my master's. I am running this a team of interns who are basically the main brains behind the Indian Activist Forum as a community. So I'm just trying to do whatever I can in my personal capacity to make sure that I not only help myself, my family, but help the whole Indian community. So my whole family was they contracted the COVID-19 virus, but like it was totally asymptomatic. Like I personally haven't been contracted with the COVID-19 virus, but I did get vaccinated. I was lucky enough to be in one of those 1% or 2% of that Indian population that actually was able to get vaccinated, because I know that we're all aware of the fact that India is running short on vaccine doses as of now. So I was privileged enough to get get vaccinated. And personally, I know a lot of people, my friends, my peers, my family members, my extended family members who have lost their loved ones, who are losing their loved ones like every passing moment. They need oxygen cylinders, they need medicines, they need hospital beds with ventilators and the ICU units. However, the Indian government, not just state government, but the Indian government as in a whole, like being the bearer of the Indian scenario, they're not able to provide us with the basic facilities. Like considering that we all pay taxes, we all pay our dues and everything, we're not still not able to avail any basic medical infrastructure and basic medical facilities living in this nation. So my personal struggle, like I do not have any personal struggle, but of course I know a lot of people, like 90% of the people I know, they're going through this whole they have their own struggles. They have their family members who are fighting pandemic. I know a lot of uh, I guess there's two of my friends who lost their fathers. Then there's one of my friend who lost his mother to this pandemic. Then there's one of my schoolmates. There's someone from my college who have lost their loved ones. So of course, I mean, it's quite saddening, and it's quite I don't really know how to express it in the right words, but it just demotivates you. It just really has a big toll on you. Like, even though I did not know that person in general, but knowing that my friend lost his father, my friend lost his mother, or his sister, or his brother, like just knowing that it has a big toll on my mental health. I feel scared to step outside of my home. I feel scared to even get vaccinated. Like getting vaccinated was a big step for me. I had this whole PPE kit like that I wore. I had to N95 masks. I had like two really big bottles of sanitizers. I sanitized my whole car. I sanitized the whole, like everything that I could see. And it was really scary. But then again, I just hope for the best. I am still trying to hold on in here. I am just trying to make sure that if I, as an individual, even if I feel scared, if I'm able to make sure that people feel more secure through the Indian Activist Forum online presence, like if that's something I can do, if I feel scared, and if I make sure that there's 10 people out there who I make feel more secure, if I feel that's something I can do, I'm just trying my level best that maybe I can play a small part in this pandemic of making sure people feel more safe, people feel more secure, and like that's pretty much it. I work a 9 to 5 job. I work in a US based mortgage firm. I'm pursuing my master's while I work. I have to make sure that there's 10 people out there. I have to make sure that I guide them in the right direction. So like I'm just trying to do whatever I can do, whatever role I can play in this pandemic to make sure that Indians, like not just Indians, but like just starting off with whatever I can, like the Indians feel secure, and maybe one step after the another, we just like have a big role. We have a small role in the big picture, and we're able to provide that sense of security, that sense of let's say people feel more satisfied, people feel more safe in this nation, within our borders, and like that's pretty much it.
It's a scary world that we live in, and I think that that you doing so much even now, even in this like the second wave that's being hit on your country is amazing, and I really applaud you for that. Okay, so the next question is, do you have any advice or words to anyone that is listening, people who can relate to this pandemic situation that's happening in India, or people who are just battling COVID in general?
uh like the first and the foremost advice would be to like just make sure to just step out only if and when it is absolutely necessary. Make sure to stay at home, make sure to get vaccinated. I mean, if you're able to book a slot for vaccination, if you're able to find the right kind of arrangements, just get vaccinated, stay at home, and of course be aware of the current scenario that is like going on in this whole nation. Because of course isolating yourself from what is happening around the world, or even what's happening within the borders of the nation that you're living in, that won't do any good to like just us as an individual, or the whole community. So of course making sure that we're updated as as a responsible citizen of the nation, making sure that we're aware of the situation that's going on in India per se. That's I think that plays a crucial part of having a certain civic responsibility. And lastly, of course, mental health. Talking about mental health, that's absolutely necessary. Not only just talking about your own mental health, but making sure that if you feel that there's someone who's not able to cope with the stress, the anxiety, or maybe a lot of people that we know, they have symptoms which might end up being like which might lead to scenarios like depression. Making sure you're there for these people, you're there to help them out, or like you're there to just I mean, you're just there for them. You make them feel that you're not alone. You're not alone in this fight. We're all facing through this. We're all facing these struggles. We're all isolated, all like on like in our within our four walls, and we're all isolated. We're not able to interact with each other. So making anyone feel that they're not alone, I guess that would be one of the best things that you can do, like during this pandemic. And like that would be really great, not just as an individual, but as an like it should be counted as your civic responsibility to make sure that your friends, your loved ones, they don't feel that they're all alone, they're fighting this battle alone. And there's a whole army behind them. There's a lot of people who are going through the same struggle, and everyone's just in this fight together.
Completely agree with you. And then the last question is, how can Cure use its platform to help those suffering in India, and help out in any way that we can?
All right. So, first of all, again, I would like to say that it's just amazing that the Cura team is actually making like real efforts to make sure that everyone in India, that they feel that again, they're not alone in this battle. they're not alone in this fight against this pandemic. There's a lot of people out there who are going through the same thing. There's a lot of people out there who are feeling the same. They're going through the same phase. They're having the same feelings. They're feeling the same emotions. So of course, the Cura team is doing an amazing job. I mean, me being here as an individual, not just representing the Indian Activist Forum, but me being here in my individual capacity, and you guys giving me the platform, you guys actually making sure that this conversation takes place in the first place. That is just absolutely amazing, and like hats off to you guys. We need more people like you who actually care about communities all around the globe. We need people who are empathetic. We need people who look after one another. So of course, like hats off to you guys. You guys are doing amazing job. And of course, I mean, whatever we as Indian Activist Forum, whatever we can do to make sure that we are able to help you guys, we are able to assist you guys per se. Maybe let's say whatever campaigns you have for pandemic situation that's going on in India, or let's just say not even in India, but for whatever campaigns you guys have going around the globe, be it in whatever continent, we will be there with you guys from the beginning to the end, and we'll make sure that people like you actually care about the global community. You care about the whole, you care about families around the globe. Like that just really gives me immense pleasure, and that just really gives me like that heartfelt emotion that you guys are like on the right track, and it just feels like absolutely amazing. So hats off to you guys. And of course, like we'll always be there to help you guys with with whatever help you guys need, with whatever assistance you guys needs. And that's pretty much it.
Thank you so much. That really, really means a lot. And the fact that you took this time out of your day to do this interview just really means a lot. And thank you so much for sharing your experiences.
Thank you so much, Divya, for having me. And again, just this last note that I would like to add for all the people who are watching this stream is like, just guys, just make sure that, I know that you might feel scared. I know that you might feel alone. I know that it might take a big toll on your mental health, but just make sure that you understand the fact that there's millions of people, not only millions, there's billions of people who are out there who are going through the same struggle, who are going through the same feelings, those same emotions. And make sure that if even if you're able to impact just one life, that's all it takes, just one life. You're able to help someone out. That's like a big step. That's like a lot. You're helping save a life. So that's like a big thing, and you guys should do whatever it takes. Make sure that everyone stays safe, you stay safe, your family stays safe, and we emerge victorious from this pandemic, as we have throughout the human history, through the several pandemics that we've been. And of course, one day we might just sit together in a room. We might just take a sip from our coffee, and maybe we're at some cafe, we're discussing about the same thing. So of course, that day might come really soon. So just hold on, and just stay safe, and all the best to you guys.
Thank you so much. We hope to see you in the future too. But yeah, bye.
All right, guys, have fun, and thank you so much again for having me.
Of course.
Well, thank you so much, Suraj and Pollock, for giving us an insight into what you are experiencing, and like more about how we can help and be activists in our society nowadays with the pandemic. Thank you so, so much. Next up, we are going to be going into another call-in that we have set up from Vidya. It's a quick note from Vidya, and she will be letting us know about what she's experienced and how her family has coped and dealt with COVID-19 through this pandemic. So Asta will be taking over from now. Thank you.
Hi. Unfortunately, Vidya couldn't be here right now, but she has written up what she was meaning to say, and I'm going to be reading it out. The whole world is suffering from a global pandemic. Every day, on average, 25,000 people are dying. Currently, India is reporting the highest number of COVID-19 cases and also the highest number of deaths. As an Indian, I can tell you that the situation is bad. It's very bad. Every day, I get to hear someone dying, and I feel helpless as well as hopeless. The Indian media is also not being able to tell the people the reality of the situation. The number of cases and deaths shown on the internet is only the number of cases and deaths reported in hospitals, and there are 1,000 people who are dying and suffering from this horrible disease without any medical assistance and treatment. Who is to blame for this condition? The government or the people or both? I feel both of them are equally responsible for this adversity. Indian government should ensure that there is an ample amount of hospital beds, oxygen cylinders, healthcare facilities, and vaccination for such an enormous population. The citizens of this country should have understood the seriousness of the pandemic and adhere to all the COVID-19 protocols to keep themselves and their families safe at home. They should have reached out for medical care if needed and get vaccinated as soon as possible. But both the government and the people of this country have failed to hold up to their duties. But now we all need to work as one and fight off this pandemic, because united we stand, divided we fall. Thank you, Vidya, for your speech.
Wow, that was very inspirational, motivational, and empowering. Thank you so much, Divya.
Perfect. So now we'll be moving on to Asta Soni. We'll have Divya sing, interview her, and we can just move on right now.
Yeah. Hi, Asta. Do you mind just introducing yourself and your connection to India?
Okay. Hi, everyone. Can you guys hear me okay? Yes.
Yes, we can hear you.
Okay. Okay, thank you. So hi everyone, my name is Asta, and I'm currently a first-year college student from India. I live in Seattle, Washington. Sorry about the background noise, but I'm very excited to be here, and thank you, Kira, for having me.
Of course. Okay, so just really briefly, I guess, could you just like touch on what's going on in India right now with the COVID crisis in just your own words?
Yeah, of course. So, I've been working with a lot of nonprofits to kind of get a grasp of what's been happening in India and do my part to stay involved. But basically, in my words, I would say that the COVID crisis happening in India is definitely one of the deadliest second outbreaks of COVID that any nation in the world has had. And, a big contributing factor to it, in my opinion, would be a lack of leadership. And I think the situation could have definitely been handled better. But unfortunately, millions of people had to lose their lives because not only our doctors were understaffed, hospitals were understaffed, but also, our leaders of the country were kind of slow on getting a grasp of the situation and kind of taking ownership and leadership.
Yep, for sure. And like I know you mentioned that you have like your Indian connection. So how have you been personally affected by this crisis, and how has it impacted your loved ones, like relatives and friends, and such?
Yeah, so actually, I was working with 3 different nonprofits that have been helping with the situation in India. And not gonna lie, for a long time, like it was really hard for me to stay fully involved just because I actually had a lot of my family pass away because of COVID. And because of the COVID situation. And through my nonprofit, we were helping patients find hospitals. And, it was getting so bad to the point where if we would connect with somebody that needed hospital, like equipment or needed oxygen cylinders or needed access to an ambulance, they'd pass away before we could even get them the resources. So, it was really difficult to try and keep up with everything. And I had to take a break because I felt really helpless, to be honest. Like anything that I would potentially get the opportunity to help with, something would happen or someone would pass away, and it was just a lot. But it was definitely rewarding, to say the least, to at least I could do something, even if it wasn't a lot, like I could get that conversation started.
I completely agree with that feeling of just feeling helpless and not knowing what to do, especially when you're sitting overseas from like all your family and you're like, what do I do for them? But yeah. So do you have any advice or words for anyone that's listening that can relate to this crisis or just like in COVID in general, just dealing a battle with that?
Yeah, so I think my biggest kind of advice is we've been dealing with this pandemic for so long. Like it feels like it's been forever. And you know, we don't really know when there's going to be like a solid end to this, or our life kind of has to evolve around COVID, so to speak, going forward. So my biggest advice would just be, take care of your mental health. It's not like this isn't like a thing where it just came and went away. Like it's something that is going to be incorporated in our daily lives, whether we like it or not. And to kind of take breaks sometimes. And with everything going on overseas, and the feeling of helplessness and that we can't get in touch with the ones that we love or we can't help them necessarily. I think self-care is really important, and just, not like figuratively self-care, like taking a day off or something, but you know yourself best. And if everything seems like too much, like you're allowed to give yourself a break. And that's probably one of the things that I wish someone had told me. So yeah.
Those are great words of advice, and I think that's something that we should definitely take away with us after this call. Okay, so last question. How can Kira use its platform to help those suffering in India? And what can we do to help?
That's a good question. So based on kind of like what I've seen through my personal work and advocacy, I think that number one, which I know Kira's already doing, is spreading awareness. Like that's probably the first step to change is, making sure that people know what's going on, because then they can help, and, being educated about whatever's happening. So I think Kira's already done a great job with awareness building and sharing and educating people. And I think another thing that could probably be beneficial is maybe finding different platforms or modes to advertise your fundraiser. Like I think doing different either like events like such as this one, or things like, utilizing social media, like doing like a bingo board or like a Chipotle fundraiser. I think like having more than one medium of fundraising is usually the most helpful, just because not everybody uses one platform where you'd be fundraising the most. So yeah.
Molly, thank you so much for your time, and we look forward to seeing you in the future. This really means a lot that you took time out of your day to come speak at this live stream.
Thank you so much for having me. Y'all are doing great work, and it was an honor.
Perfect. I'm handing this off to Nithya to introduce our next speaker.
So next up, we have a call-in from Shravya Kaklamari. She is an incoming medical student, and I'm so excited to have you here, Shravya. Please get started. Asta will be starting off with the first question.
Thanks so much for having me.
Okay, hi. We have a few questions set up. First, could you please introduce yourself, including your name, your location, any information you think we want to know?
Yeah, my name is Shravya. I am calling in from Seattle. I recently graduated from college and, like Nithya said, am an incoming medical student.
Okay, next question. Why did you want to call in?
I really just wanted to be able to provide my perspective, kind of just living overseas, learning about what's going on in India. And I just wanted to be able to share what I've learned so far, and also just commend y'all for all the great work you're doing.
Okay. And then how has this pandemic affected you, your family, and your friends?
I've been fortunate to be in a place where there is the infrastructure in place for us to receive the care that we need, but I have lots of family in India where I can't necessarily say the same thing for. And I have quite a few elderly family members that I'm constantly worried about. So I'm constantly checking in with them to make sure that they're being safe, isolating as much as possible. But I think, as outsiders, it's difficult for us to understand the magnitude of the crisis that's happening overseas, apart from like what we read in news articles or see in videos. So, and like y'all said, so many cases are going undocumented. And I will say that's a huge issue in a lot of low resource settings. So I think that's just been difficult to really understand what is happening and how it's happening. But I think it's been difficult overall. And because like the feeling of helplessness, not knowing what to do, there's just so much uncertainty and not being really able to control anything from overseas.
Yeah, I totally get that. And then any words of advice or wisdom on how we can support our community during this time?
Well, once again, I just want to commend y'all for doing such a great job on using your platform to spread awareness, which is really one of the most important things to do during this time, as well as raise money for such an important cause. It really is amazing what y'all are doing at such a young age. But second, I do want to encourage everyone to continue educating themselves about the COVID-19 crisis in India. And if you have the financial capability to do so, please donate. But if not, I think it's a common misconception that money is going to help, but like that's not the extent of what you can do. You can do things beyond that, like education. So continue to educate yourself and spread awareness of the crisis to others. There is a lot of misinformation out there regarding COVID at the moment, so try to tackle that and challenge your friends and family to do the same so everyone really understands the consequences and ramifications of COVID. Try to watch videos, read news articles that are from reputable sources. You mentioned earlier in the stream that a lot of the media right now is currently sugarcoating the issue, which is completely true. The situation there is so dire, and not everyone really understands what's happening because media doesn't cover it honestly, because it's so heartbreaking and scary to watch those videos or see the actual statistics and numbers. But that is the harsh reality of what it is right now. So I recently actually watched a video about a 26-year-old doctor in India who actually has to decide between who lives and dies, and he has to make that really difficult decision. And he's so young, and I can't even imagine how scary that might be. So, and on top of all that, he hasn't even had the chance to receive a vaccine, so he's out there risking his life for these patients. So, this is just one of the few videos that I've watched that kind of really accurately portrayed the situation. So watch those sorts of videos. Continue to educate yourself and share these videos with others. Share them on WhatsApp because I know that's a huge source of communication for a lot of Indian families out there. But lastly, just check in with your loved ones and make sure that they're doing okay, and be hopeful that better things are around the corner.
Yeah, thank you so much for calling in. It was so great to hear your perspective.
Yeah, thanks so much for having me, guys. Great job.
Bye.
Thank you, guys. Okay, we're about to move on to our next activity. Again, if you guys want to sign up for these call-ins and do what our amazing speakers just did, we will send a link in the YouTube chat, and we could go ahead and move on. So we're about to take a 5-minute break, and after that, we're gonna start our Kahoot.
Yes, so if you do want to call in, just go ahead and join the call-ins and we will do that. Otherwise, we get no call-ins, we will move on to Kahoot. So we'll be regrouping at 4:40.
Also, another reminder that we do have our auction on. The link is in the YouTube chat, so feel free to donate and you can win some pretty cool prizes.
Okay, guys, we are about to start. We're getting a Kahoot set up. I recommend everyone join. Nithya will screen share and we can go ahead and start.
Yes, so we have a Kahoot up and running. The code is 7193432. Well, we have our first participant, Aditi. Thank you so much for joining us. Wow, thank you so much for joining us, Joe and Sarah. Sorry.
I just want to say, if you join this Kahoot and you happen to win, you get a bunch of like bragging rights. So definitely join. Oh, and then after this Kahoot, we will be doing our auction too. So make sure to go and sign up with that 32 auctions link that we put in our chat like a little bit ago. And that way you can take part in the auction. It'll be really worth your time.
Okay, we will be starting the game in the next 2 minutes. Sorry.
Do we want to go ahead and get started with this?
Okay, we will give you guys until 4:45 just to make sure that we get everyone. Okay, so we will get started on the game. So our first question is, what day is India's Independence Day? Okay, so one of you guys who guessed August 5th, another one who guessed July 4th. Okay, July 4th is America's Independence Day. August 5th is very, very near. It's actually August 15th. So good job to those who got that right. The next question is, well, first off, we have our lead is Aditi, so good job, Aditi. Then we have upcoming is Sarah, Arnav, and I will win, and Joe. Good job, guys. Our next question is, multi-select. Which of these are regional film industries in India? Good job to those who guessed Bollywood, Tollywood, and Pollywood. Obviously, Hollywood is an American film industry, and the rest are Indian film industry. So good job to those who have guessed right. In our lead, we have I Will Win. Good job. Next question is, which of these is a classical Indian dance? Jazz, pop, kuchipudi, or salsa? Nice job. All of you guys got that right. It is kuchipudi. Good job. I will win with an answer streak of 3. Next question is a true or false. India has the second biggest population in the world. True or false? Nice job to those who guessed true. Yes, India has the second biggest population in the world. Good job. I will win with an answer streak of 4. Next question. How many new reported cases does India have every day? I believe all of you should be knowing this, as we did go over this in our Educate seminar earlier today. The correct answer is 400,000. About 400,000. India does have about 400,000 reported new cases every day. Good job, Arnav, with an answer streak of 5. How many new reported deaths does India have every day? We went over this in our Educate seminar as well. Yes, the correct answer is over 4,000 cases. Over 4,000 reported deaths are reported every single day in India. Next question is, what is the most subscribed YouTube channel? y'all might be wondering why I chose YouTube channel, because this is an India relief live stream. So the answer probably is an Indian YouTube channel. So that's a clue. Yes, the correct answer is T-Series. Next question. What is the name of India's national anthem? The correct answer is Jana Gana Mana. Good job. So we have 2 more questions. The next question is a bit more about the live stream, which is, did you donate to Cura Project's Give India Fund yet? Thank you so much for donating. And even if you haven't donated, no worries. We just really do appreciate you being here and learning more about India's COVID crisis and eventually giving all of your knowledge to your community as well. Thank you so much. Our next question is a multi-select. How is the live stream so far? Thank you so much for the advice. We will obviously make our live stream much better. And thank you so much for also saying that you like the live stream. So with that, we're going to see who our winner is and who has bragging rights.
Woo, go Arnav and Sarah.
And now we have in first place, I will win. Nice job.
I wonder who that is.
Nice job.
All right, guys, we're about to finish. Real quick, just want to remind you about the auction that we have set up. So I'm going to just screen share and show you guys some of the things that we have available. The auction will be open for another week. So if you want to go and check that out, it's open. The link is still in the chat, and I'll just screen share real quick and show you what we got going on. Okay. Right now, we see 2 items. Our first item is a Cura pack. So in our Cura pack, we have a couple things. First one is Cura hoodies. We'll give 2 Cura hoodies, a medium and a large. Here's a picture of the front and back. And then we have stickers. These Cura stickers are handmade from one of our graphic designers, Asta Shah, who's also on this call. Next, we have our next one is really fun. We had an artist paint this for us. This is handmade just for Cura. It has to do with the fall theme. She thought that it was very Halloween-y, and she really likes Halloween. So she made this for us. As you can see, there's a fox on top of her head and someone dancing in the woods. And I think this is great. The starting bid is $15, and you could only go up by $2. So we'll see you. We hope you purchase these things. They're super, super great. I think that concludes it then.
Yes, the auction will be open until tomorrow, and we will announce the winner. And good luck to all of you guys, and I hope you guys get some great Cura merch and stuff.
And last but not least, I would like to shout out the webinar at the end of our week. So just to recap, this is the beginning of our Cure live stream. The live stream is just starting off India Relief Week. Then we'll end it off with, we'll start with the 5 days of posts, podcasts, and videos that go up on our Instagram. And finally, we have a webinar. And what's important about this webinar is that we have an art competition. And I really recommend all of you guys go and participate in the art competition. If you want more details, it's in our Instagram.
Yes, and feel free to reach out to us at cureproject21@gmail.com or go ahead and check out the cureproject.org website if you have any questions.
Yep, and definitely please donate, whether that be participating in the auction or just straight up just donating through our Venmo and PayPal. Please donate, because all of this money will be going to India relief efforts, and I think that's something that India needs desperately right now, with just like the shortages of just supplies and everything. So let's do our best to help out in the ways that we can, and so please definitely donate.
And even if you cannot donate, don't fret about that. Just maybe educate your community about what you've learned in this live stream, educate your community about that, and just spread awareness about India's COVID crisis so you can get more people involved in the situation to help their community as well.
Perfect. Okay, well, that wraps it up. Thank you for joining. Again, donate. The links are in the chat. Go check out the auction, and obviously go look at our Instagram for updates for throughout the next week. Thank you. Bye.
Thank you so much.
Thank you.